welcome to my YouTube channel. Today I'm going to be talking to you about chiropractors and their social media activity in the context of coronavirus. What I want to do today is actually go through some specific examples and show you some of the things that I've been finding and really discuss what the issues are and why I don't consider them to be essential healthcare providers. All right, I'm going to jump in here for a minute and give a little bit of context and try and frame this video correctly. I do believe in understanding all different sides of an issue. So with that in mind, I spoke with Marc Bronson, and he's a chiropractor in Canada. He runs the Facebook group Evidence-Based Chiropractors, and he also has this new website, which is ebc.network. So he would be a great resource for anybody who has any questions about evidence-based chiropractics and what the field overall thinks of these types of claims that are coming out from what are called vitalist chiropractors. They are their philosophy and their pseudoscience. It really stems back to the history and the founder of chiropractics, who is Daniel David Palmer. Chiropractic schools are teaching this information and they're teaching it as facts. Please know that this is not a representation of everybody who is a chiropractor. So without further ado, let's jump back into it. I really hate to see that people are using this pandemic as an opportunity to for their own financial gain. I've been very surprised at what I've been finding and just how much of this content is out there. In my opinion, unethical and something that you wouldn't expect to see from what they've been categorized, which is essential healthcare providers. I also take issue with the fact that chiropractors are categorized as this, and I know that a lot of people are actually going to disagree with me on this. I welcome that discussion. I really think that these clinics remaining open and especially accepting new patients that are non-urgent appointments are causing more harm than good. And the arguments that I've been seeing online about this, where people have been saying, no, chiropractors actually provide a much needed treatment to the public and it is essential. The argument with that conversation has been kind of wackadoo, honestly. It's been people who are saying if you come in and get your back adjusted, then your immune system is going to be boosted 200% or 400%. And it's just, that isn't based on science. That isn't based on research. There is nothing that shows that that's the case. And it's crazy to me that people are saying this, because when really look into the details and try and pull up information and try and find the source of that claim, you you start to see that there's nothing there. And I'm not sure why chiropractors were considered to be essential services in the midst of a pandemic, but everything that I've been seeing has indicated that there are more risks associated with these different clinics staying open than there are with them closing. And I just wanted to read a comment really quick that I found on Facebook from a chiropractor. He says, in my opinion, at this time, no, it is not essential. In my opinion, most chiropractic offices provide a place to transmit the virus more effectively than in most other settings that remain open. How is it essential? People who are saying it's essential, I would like to see why you think that, and don't come at me with some crap about boosting the immune system. While that might be true, we can't prove it in science, and we shouldn't say it right now, or we will be harshly judged for causing people's deaths. Now, what I'd like to do is go through on Instagram Live while I'm recording this and just show you how pervasive this is. And you can do this yourself if you have Instagram, or I think if you want to check on any other platform, if you just type in hashtag chiropractor, hashtag get adjusted, then you're going to see for yourself. You don't need me. You'll see that I'm not actually cherry picking this information. It's kind of overwhelming. And I'm just going through and scrolling until I see something that looks like it's relevant. So this is a post that is from a clinic here in California. They are located in Carlsbad, and what this says is, chiropractic is essential. We are open. Come in, get adjusted, heal better. And in the caption, it reads, according to the Federation of Chiropractic Licensing Board, an organization dedicated to public health, which follows guidelines and recommendations regulated by the CDC and World Health Organization, affirms that chiropractic is essential. We are open and we are here for you. Adjustments are imperative to maintain your health and optimize your immune system. Continue to come in for regular adjustments so I can continue to help and heal you so you can feel your best. When I read something like this, I have to say that it's quite frustrating to see. People are just taking such proactive steps to flatten the curve. And then you see these chiropractors who are just putting this information out there and just being bold and saying, yeah, we're open, come on in. And it's super frustrating. And let's keep going. Rant over. All right. I'm just scrolling by super quick to just see anything that stands out as being related to coronavirus. Here we go. This one, this post doesn't have anything on it that it says coronavirus. It's caught my attention because, and I'll paste this in, but just to give you a quick idea, you can see that there is a child getting a adjustment. And whenever I see stuff like this, honestly, it just... I feel very, very uncomfortable with this. I think that children should not be having this done, and there are posts on social media where babies are having adjustments, and that stuff just really scares me. I just don't think that children should have their spine manipulated. But okay, so this post says, we are still open, getting everybody tuned up. Our role is to take pressure off the medical system. So this is great. We're going to hear a little bit more about the rationale. I'm excited to actually continue reading this. If you are struggling with symptoms that don't require medical attention, such as headaches, back pain, neck pain, or other spine-related complaints, then we are here to help. We are also working with clients to help with extra stress at this time. It's important that our stress levels don't lower our immune system. Either way, we're here to help you keep healthy and stress-free. That's not essential. This is not an essential service that needs to be provided during a pandemic. It's kind of why I've taken the time to kind of monitor this and keep an eye on it and raise attention to it, because I think that without government intervention and intervention from the appropriate professional associations, then nothing is going to change. They're going to continue to be offering services and then also potentially spreading coronavirus and contaminating more people than is necessary. Okay, well, this one, we've already gone through this. So we are open, normal hours, blah, blah, blah. Don't need to do that. This is off topics. Chiropractic and pregnancy benefits. That'll be another rant or another video. They've been also doing these statements, these like PSAs with social media and then also with email. And so this one says, same rhetoric over and over again. In an effort to mitigate the strain being placed upon the hospitals and emergency rooms, and the fact that chiropractors are recognized as primary care providers in the state of Wisconsin, I want to personally send out an invitation to everyone here. And because we are open, we are asking that unless you have coronavirus-like symptoms, that any of our healthcare issues that you may have, please explore chiropractic as a first option to your healthcare. In this way, we can help to reduce the load on hospitals and free up beds for those suffering. We're doing everything we can to support the community up to this point. This is not the time to be slowing down the medical system with anything that isn't coronavirus related. This is our chance to shift the current and help out further. If you have healthcare needs of any type, at the specific, we have the necessary skills to sort everything out for you. Make chiropractic your first line of defense. This is an interesting one because there's some positive and then there's some negative to it. I like that this person's saying that we aim to reduce the overload that's happening at emergency rooms and hospitals, but I don't like that they're saying here that this should be your first line of defense for anything under the sun. That's extending the scope of practice to chiropractors in a way that is just could potentially be more harmful. What if somebody is having heart palpitations? What if somebody is having issues with their medications? There's a whole just range of things that chiropractors are not qualified to be able to diagnose or assess. During the pandemic, we all need to be making sure that we take special care in how we communicate on social media, and that we make sure to stay within our scope of practice. And I myself have been very cautious of this, because somebody who has a background in communication and is talking about coronavirus, I want to make sure that I always focus on the communication component and the way things are coming across, the way messages are being conveyed. So I think that the right thing to do would be to say, these are the types of patients that we can be helping out. People with these sorts of symptoms should consider us a first line of defense. It has to be done right. It has to be done appropriately, and people need to be aware of where they can help and then where they can harm as well. I do think that there are definitely good people in this field, and that's probably the majority of folks, but it's the vocal minority on social media that gets the most attention. I really hope with my video today and with my posts on Twitter that bringing more awareness to this, we can kind of work together to get some of these accounts to change their tune and not post the way they have been, because I think there are consequences to this behavior, and one of which could be that there's further spread of coronavirus. So, and that's a serious risk, and that's a serious concern, given how chiropractors conduct their massages or their spinal manipulations. It's not something that you can do with maintaining 6 feet distance. You are very close to a patient. They're not required to be wearing masks or any sort of protective gear. So all these offices are just saying, if you're sick, if you're feeling sick, if you have these symptoms, if you have a fever, then don't come in, stay home. But as we know, with information that's coming out about coronavirus so far, it's that a lot of people are asymptomatic. That's just a reason why, a motivation for closing these offices and designating them as non-essential. A lot of different chiropractors have actually taken this stance as well, and they've been posting on social media that their offices are closed. That's been wonderful to see. I think that's a great use of social media.